Hey everyone, do you know what is bronchial hygiene therapy or what is Edwin Clean's technique, that is ACT? No? Let me guide you. These techniques are hired to clear out the secretion from the chest wall. All the conditions which come under the umbrella term of COPD, which are obstructive conditions, which have a tendency of creating so much of secretion in the airways, these techniques are given to the patient to clear out the secretions from the trachea. So starting with our very first technique, which is postural drainage. In postural drainage, we give the patient different positions in which gravity assists in draining the secretions. Now coming to second technique, which is percussion, vibration and shaking. In percussion, we make our hand in cup shape and give tapping or percussion on the chest wall. In vibration, we keep our one hand on the other and give vibration to the different segments, that is bronchopulmonary segments of the lungs. In third, that is shaking, it is a vigorous form of vibration in which we shake the whole of the chest wall to drain the secretions. Now coming to third technique, which is ACBT, which is active cycle or breathing technique. It consists of three phases of breath control, of thoracic expansion, that is depth breath, and third, which is a forced expiration technique, that is huffing and coughing. We have 3 to 4 phases of these three techniques in which it helps in the drainage of the secretion out of the trachea. Coming to the next technique, which is autogenic drainage. In autogenic drainage, there are 3 phases. First is the unsticking phase, second it is the collecting phase, and third is the evacuation phase of the cough. So in these 3 phases, there are different levels of breathe in and breathe out. So the tidal volume, it differs in all these phases, and which helps in unsticking of the mucus, unsticking of the secretion and giving it out through trachea. Coming to our next techniques, which are OPAP devices, which is oscillatory positive expiratory pressure devices. So basically all the devices, they create a back pressure in the trachea which helps in removal of the secretions. They are flutter, a cappella, lung fluid. All this helps in clearing the chest from the secretions. We can also give suctioning after all these techniques to clear out the chest wall. And in cases when the cough reflex is not being initiated, we can also go for manual hyperinflation. It stimulates the cough reflex, which causes the forced expiration by the contraction of abdominal muscles and clearing out the secretions. We can also go for a device which is known as high frequency chest wall oscillation. So basically it looks like a life jacket. We have to tie it to the patient's chest wall, and when the device is switched on, it creates vigorous high frequency chest wall oscillations which helps in draining the secretions out of the trachea. And last we have cuff assist insufflator, exsufflator.